Hello everyone, I'm Anthony D'Souza and welcome to this series of videos on the exciting world of healthcare science.
Hi, I'm Amy and I'm the Simulation Centre Manager at Great Ormond Street, and we train different healthcare professionals using simulation education. This is our simulation suite. Here we have Paediatric Hal, who is ready to teach different healthcare professionals. We can make him go through a range of different conditions and illnesses, and this is where clinicians are able to identify and treat him. So we have 5 different mannequins here at the centre. We've got Paediatric Hal, which is a high fidelity mannequin. He can play the ages of about 5 to 12 at the maximum. We then have Newborn Hal, who is a tiny baby mannequin. We have Super Tori, who's a little bit bigger than Newborn Hal. We then have 1-year-old Hal, which is the size of a 1-year-old. I would say he looks a little bit bigger than that. And then we have 5-year-old Hal, which is they're all high fidelity mannequins. And then we have Slade, which is a teenage mannequin. So he can play the ages of up to 18, which is really nice. And then we also have 3 non-technical mannequins. 2 of them are around the age of 12, and then one of them is an open chest mannequin, which is around the age of 4. Here in the control room, I have 3 computers set up. 2 of them are mannequin tablets where we run Paediatric Hal Software Uni. One of them is the controller, where I can control the different aspects of Paediatric Hal. And then one of them is the Vital Signs Monitor. So as a Simulation Centre Manager, I look after the courses in the centre by making sure that we have candidates for the course, that we have everything that we need to run it. That's from the equipment, the scenarios, the timetable. I set up the courses. I run tech on courses, which means I control the mannequins. I advertise courses. I look after the finances of courses and office management. The best bit of my job is working at Great Ormond Street. Is that really cheesy? I specifically moved here because I wanted to work in a team that works with everyone from around a hospital. Every day you get to work with new people in different careers. You get to learn about what they're doing, and it inspires you to keep doing what you're doing. When I was 17, I left school and I wasn't completely sure what I wanted to do. I knew that I wanted to work in a healthcare environment. I didn't know how to do that without going to university. I came across apprenticeships and I found a really great one in clinical technology at King's College Hospital. I got onto the apprenticeship scheme and they placed me in an emergency department, which I absolutely loved. I loved the busyness, I loved the high pressure environment. I then got to move on to another department where I eventually got a job and I stayed there for 5 years. It helped me discover simulation, which I work in now and absolutely love. When I got a job in clinical simulation, I was able to continue doing my apprenticeship qualification in clinical healthcare and technology. I now also do a degree in biomedicine, which I'm studying part-time outside of work. If you want to get into simulation, then looking at simulation technician roles would be a great way to start. Also looking at centre assistant roles would be a great way to get into a simulation centre. You can then train on different mannequins and high fidelity pieces of equipment and gain your technician registration through ASPE.